Rahim. Effectiveness of hydrogen-rich water on antioxidant status of subjects with potential metabolic syndrome and open-label pilot study. Hidrojence zenginleştirilmiş suyun etkisi. Ne üzerindeki etkisi? Antioxidant status of subjects. Yani nesneler üzerindeki antioksidant durumuna etkisi. With potential metabolic syndrome, yani metabolik bozukluklar, potansiyel metabolik bozukluklar sahibi olan kişiler üzerinde kişilerin antioksidan durumları üzerindeki hidrojence zenginleştirilmiş suyun etkisi. An open label pilot study. Bir açık etiketli pilot çalışma. Yani açık etiketli open label çalışan kişiler ve üzerinde çalışılan kişilerin isimlerinin belli olduğu pilot study, yani küçük bir kısım, küçük bir bölgede, pilot bir bölgede yapılmış olan bir çalışma. 15 Ekim 2009'da alınmış, 6 Kasım 2009'da kabul edilmiş, 2010 24 Şubat'ta da basılmış. Summary, özet. Metabolic syndrome is characterized by cardiometabolic risk factors that include obesity, insulin resistance, hypertension, and dyslipidemia. Yani metabolik sendrom nedir? Metabolik sendrom şöyle karakterize edilmiştir. Kardiyometabolik, yani kalple ve metabolizma ile ilgili risk faktörleri, ki bunlar nedir? Kardiyometabolik risk faktörleri nedir? Obezite, şişmanlık, insülin resistance, insülin direnci, hypertension, yani yüksek tansiyon, and dyslipidemia, bu da kan damarlardaki yağlanma. Oksidatif, yani bunları içeren risk faktörlerine kardiyometabolik risk faktörleri deniyormuş. Bu olaylar da bu tür problemler de neyi ifade ediyor? Metabolik sendrom, metabolik bozukluklar. Oxidative stress is known to play a major role in the pathogenesis of metabolic syndromes. Yani oksidatif stres, vücuttaki oksit yoğunluğunun büyük bir rol oynadığını biliyoruz. Ne konuda büyük bir rol oynuyor oksit yoğunluğu, oksidatif stres? Metabolik sendromların oluşmasında, patojenlerin oluşmasında. Metabolik sendromlara sebep olan, metabolik sendromları içeren patojenler, yani hastalık belirtileri. Bu konularda büyük bir etkiye sahip. Major role. The objective of this study was to examine the effectiveness of hydrogen-rich water. Bu çalışmanın amacı hidrojence zenginleştirilmiş olan suyun etkisini test etmek. 1,5-2 litre, 1.5 to 2 liters per day, günlük 1,5-2 litre içildiğinde, in an open label, açık etiketle, yani kimlerin içtiği belli, 8 week study, 8 haftalık bir çalışma yapılmış, on 20 subjects with potential metabolic syndrome, yani potansiyel olarak metabolik bozuklukları olma ihtimali olan 20 tane kişi üzerinde 8 haftalık günde 1,5-2 litre zenginleştirilmiş, hidrojence zenginleştirilmiş su içen kişilerin üzerindeki etki araştırıldı. Hydrogen-rich water was produced. Bu hidrojence zenginleştirilmiş su şu şekilde üretildi. By placing a metallic magnesium stick into drinking water. Bir suyun içine, içme suyunun içine bir magnezyum çubuğu konularak üretildi. Hydrogen concentration, hidrojen konsantrasyonu 0.55-0.65, 0.65 millimole. By the following chemical reaction, aşağıdaki kimyasal reaksiyon kullanılarak bir magnezyum çubuğu suyun içine daldırılarak hidrojenle zenginleştirilme yapılmış. Nasıl? Magnezyum ile artı 2H2O, yani magnezyumla 2 tane H2O molekülü birleşiyor. Magnezyum artı 2 tane H2O kimyasal tepkimeye giriyor ve sonuçta H2 çıkıyor artı magnezyum OH2, magnezyum OH2, magnezyum hidroksit çıkıyor. Yani hidrojen ve magnezyum hidroksit. The consumption of hydrogen rich water for 8 weeks, 8 hafta boyunca bu hidrojence zenginleştirilmiş suyun harcanması, kullanılması yine 39% increase, yani %39 bir artış sağladı. In antioxidant enzim, antioksidant bir enzim olan superoxide dismutase, superoxide dismutase, kısaltması SOD. Bu superoxide dismutase'in %39 artmasına sebep oldu ve and a 43% decrease in thiobarbituric acid reactive substances in urine. Yani üre içinde de, idrar içinde de %43'lük bir düşüşe sebebiyet verdi. Neyin %43'lük düşüşüne? Thiobarbituric acid reactive substances, yani kısaca TBARS seviyesinin %43 düşmesine sebebiyet verdi. Further ve daha sonra ve ileri daha da ötesi, subjects demonstrated an 80% increase in high density lipoprotein kolesterol. Ve bunun ötesinde de bu 20 tane hidrojenli suyu, bol hidrojenli suyu kullanan kişi %8 seviyesinde lipoprotein kolesterolünde artış, ki bu faydalı bir kolesterol bildiğim kadarıyla. And a 13% decrease in total cholesterol HDL from baseline to week 4 ve 4. haftaya kadar total kolesterol seviyesinde %43'lük bir düşüş. Kolesterolda da düşüş. HDL kolesterol. Lipoprotein kolesterol artış. Kolesterolda da düşüş görülmüş. There was no change in fasting glucose levels. Açlık kan seviyesinde bir değişiklik görülmedi. During the 8 week study, 8 haftalık çalışma boyunca. Özetle, in conclusion, drinking hydrogen rich water represents a potentially novel therapeutic and preventive strategy for metabolic syndrome. Özetle, hidrojence zenginleştirilmiş suyun kullanılması potansiyel olarak harika bir iyileştirici ve koruyucu, muhafaza edici bir strateji olduğu görülmüştür. Ne için? Metabolik sendromlar için. Yani metabolik bozulmalar için. The portable magnesium stick was a safe, easy and effective method of delivering hydrogen-rich water for daily consumption of by participants in the study. Taşınabilir magnezyum çubuğu ise hem güvenli, hem kolay, hem de verimli bir hidrojen zenginleştirme yöntemidir. Ne için? Günlük içme suyu üretimi, tüketimi için bu çalışmada çalışmaya katılan 20 tane kişi açısından. Yani 20 kişi üzerinde 8 haftalık bir çalışma yapılmış. Ve bu 8 haftalık çalışmada ne yapılmış? Hidrojence su zenginleştirilmiş. Magnezyum artı 2H2O. Magnezyum çubuğu bırakılıyor suya. Magnezyum artı 2H2O reaksiyona giriyor. Karşılığında magnezyum oksit artı H2. Magnezyum oksit tabi magnezyum oksit muhtemelen vücuda girmesini engelliyor olabilirler. Devamını okumadım. Yani bunun muhtemelen bir zararı olabilir. Ama H2O suyun içinde kalıyor. Dolayısıyla H2 suyun içinde kalıyor. Dolayısıyla şu kimyasal tepkime sonucunda suyun içinde H2 molekülleri çoğalmış oluyor. Bunu yapmak için de taşınabilir magnezyum bir çubuk kullanılmış. Bunun çok ciddi faydası olduğu görülmüş. Ne gibi? Antioksidan bir enzim olan süperoksit dismutaz yani SOD %43 artmış. %39 artmış, özür dilerim. Ve zararlı substances yani üredeki tıbars parçacıklarında %43 düşme görülmüş. %8 faydalı lipoproteinde artış ve kolesterolde %13 toplamda düşme görülmüş. Glukozda herhangi bir değişiklik görülmemiş. Bu da bir zararı olmadan faydalı bir teknik ile metabolik sendromların azaltılması ya da sağlıklı bir şekilde devam etmesi için bir yöntem olarak teklif ediliyor. Keywords, anahtar kelimeler: hidrojen, drinking water, içme suyu, magnezyum, oksidatif stres, yani sudaki ya da vücuttaki ya da ortamdaki oksidatif maddelerin çokluğu, metabolik sendrom, sorunlar, problemler, hastalıklar. Akademik çalışmanın tamamı bu videonun linkine eklendi. Tıklayıp okunabilir. Introduction. Metabolic syndrome is characterized by a constellation of metabolic and anthropometric abnormalities, which include excess weight, hyperglycemia, hypertension, low concentration of high-density lipoprotein (HDL) cholesterol, and hypertriglyceridemia. Metabolic disease remains a serious concern in the United States, and people with metabolic syndrome are at increased risk of developing cardiovascular disease and type 2 diabetes. Free radicals and other reactive oxygen species, ROS, are derived either from normal essential metabolic processes in the human body or from external sources such as exposure to X-rays, ozone, cigarette smoking, air pollutants, and industrial chemicals. Disturbance of the balance between production of oxygen-free radicals or some other radical species and activity of the antioxidant system or protection causes oxidative stress. Recent evidence implicated oxidative stress in the pathogenesis of metabolic syndrome. Oxidative stress and nutritional changes also contribute to the aging process and to many age-related diseases and may affect cardiovascular function by either involving the long-term development of atherosclerosis or causing immediate damage during a heart attack or stroke. Typically, ROS, reactive oxygen species. Typically, ROS reacts with lipids, causing lipid peroxidation, leading to oxidative destruction of unsaturated fatty acids and damage of cell membranes with indirect damage to other cell constituents. Therefore, mitigating oxidative stress may have a significant impact for people in pre-metabolic syndrome status. Hydrogen has been identified as having therapeutic antioxidant properties by selectively reducing cytotoxic ROS in tissues. as hydrogen is a gaseous molecule, inhaled hydrogen might be an easy delivering strategy, although it is safe at a concentration lower than its threshold of 4.6% in the air. The translational applicability of inhaled hydrogen gas is limited to medical care facilities as it's an inflammable gas and cannot be realistically and safely administered. Oral intake of liquid containing hydrogen represents a novel and easily translatable method of delivering hydrogen gas. Previous animal studies have linked daily consumption of hydrogen-rich water generated by bubbling or direct contact with hydrogen gas with reduced atherosclerosis in apolipoprotein E knockout mice, alleviated cisplatin-induced nephrotoxicity, improved vitamin C deficiency-induced brain injury, and prevented chronic allograft nephropathy after renal transplantation. In addition, the beneficial effects of consuming hydrogen-rich water in the prevention of adult-onset diabetes and insulin resistance has been reported in a human study. The hypothesis that oral intake of hydrogen-rich water generated via magnesium stick may reduce oxidative stress in human subjects with potential metabolic syndrome. As metabolic syndrome is a disease closely associated with lifestyle-related habits, oral intake of hydrogen on a daily basis via drinking water may be ideal for people without complicating or changing their lifestyle. The administration of hydrogen-rich water via a portable magnesium stick was considered to be a safe and feasible method of delivery and was investigated in an open-label study on subjects with potential metabolic syndrome. Materials and methods, subjects and design. This study was an open-label pilot study conducted at a single site with an 8-week treatment period. 20 subjects greater or equal to 40 years, males, number of 10, and females, number of 10, were enrolled from existing patient databases or by advertisements. In order to qualify, subjects were required to have one or more of the following conditions. In order to qualify, subjects were required to have one or more of the following conditions. Body mass index, BMI, between 25 and 34.9 kilogram per meter squared. Waist circumference of greater or equal to 100 centimeters for males and greater or equal to 88 centimeters for females. Pre-hypertension, diastolic blood pressure of 80 to 89 millimeter Hg and systolic blood pressure of 139 mmHg, millimeter Hg or lower, millimeter mercury. Pre-diabetes, fasting plasma glucose from 5.2 to 6.9 mmol per liter. Total cholesterol is higher than 5.18 millimeter OL over L over liter, and or low density lipoprotein LDL is greater than 2.59 mmol per liter. At screening, subjects provided written informed consent and inclusion and exclusion criteria, medical history and prior use of concomitant medications were reviewed. Subjects were required to be weight stable for 3 months prior to study, and those subjects that were smokers were encouraged not to change their smoking habits. Subjects were required to discontinue other natural health products. Were required to discontinue other natural health products 3 weeks prior to randomization and during the study, and to maintain their current level of physical activity and dietary habits during the course of the study. Subjects were excluded from participating if they were pregnant, breastfeeding, and planning to become pregnant, had uncontrolled hypertension, or history of diagnosed disease or condition including diabetes type 1 or type 2, cardiovascular disease, cancer, renal or liver disease, history of psychiatric disorder or drug alcohol abuse, used prescription or over-the-counter products for vasodilation, erectile dysfunction, weight loss, and or hypercholesterolemia, use of anticoagulants, and had participated in a clinical research trial within 30 days prior to randomization. This study was conducted at KGK Synergize Inc. London, Canada. The study was conducted in accordance with good clinical practice guidelines and the ethical principles of the Declaration of Helsinki 2000 year. The study protocol and materials were approved by the Institutional Review Board Services, Aurora, Ontario, and all subjects gave written informed consent prior to participation. Investigational products, production of hydrogen water. A plastic shells product consisting of metallic magnesium 99.9% pure and natural stones in a polypropylene containers combined with ceramics. Dr. Sui, Frontier, Tokyo, Japan, was used to produce hydrogen. The product was capable of generating hydrogen when placing in drinking water by the following chemical reaction. Magnesium plus 2 H2O to water molecule yields magnesium oxide plus hydrogen 2 molecule, shown in figure 1. Hydrogen water sticks were dispensed at baseline and week 4, and used sticks were collected at week 4 and week 8, and compliance calculated. In a retrospective study conducted at the University of Pittsburgh, in a setting similar to the study procedures followed in the current study, the hydrogen concentration in water bottle was sequentially monitored using a hydrogen needle sensor, DHS-001, Able, Tokyo, Japan. It was determined that the hydrogen concentration was maintained between 0.55 and 0.65 millimeters and pH between 7.9 and 8.1 over a 12 to 36 hour period. When monitored twice a day at weekly intervals for 4 weeks, it was further documented that the magnesium stick maintained the hydrogen concentration in the water bottles for the desired length of the study. The concentration of magnesium and calcium in the water were also measured using a standard method, ASTM D51109. ASTM International West Conshohocken PA conducted. At University of Pittsburgh and found to be smaller than 1 milligram per liter and 1 milligram per liter respectively. Figure 1. Hydrogen concentration versus weeks. A magnesium stick and the methods to generate hydrogen water in 500 milliliter bottles of drinking water. A plastic shelled product consisting of metallic magnesium 99.9% pure and natural stones in the polypropylene containers combined with ceramics. Dr. Sui Soi, friend here in Tokyo, Japan, was used to produce hydrogen. The product was capable of generating hydrogen when placing in drinking water by the following chemical reaction. Magnesium plus 2 water molecule yields magnesium oxide plus H2. B. Hydrogen concentrations in the water bottle N is equal to 3. The hydrogen concentration in the water bottle was maintained between 0.55 and 0.65 millimole over an 8-week period. Study protocols, dose and mode of administration. Subjects were provided with 500 milliliter bottles of drinking water and instructed to place 2 magnesium sticks in each of 5 bottles of water at the end of each day in preparation for consumption the following day. Participants were asked to drink 3 to 400 milliliters from bottle 1 each morning, 1 hour before breakfast, 3 to 400 milliliters from bottle 2, 1 hour before lunch, 3 to 400 milliliters from bottle 3, 2 hours after lunch, 300 to 400 milliliters from bottle 4, 1 hour before supper, and 300 to 400 milliliters from bottle 5, 1/2 hour before bedtime, as per instructions provided in the informed consent form. Subjects were instructed to reuse the magnesium sticks by transferring the sticks to a new bottle of water after use. In summary, subjects were expected to consume 300 to 400 milliliters of hydrogen-rich water 5 times per day for a total minimum consumption of 1,500 milliliters, 1.5 liters, to a maximum consumption of 2,000 milliliters, 2 liters. Assessment of health and psychological parameters. This study included 4 clinic visits, which occurred at screening, baseline, week 4 and week 8. At baseline, week 4 and week 8, blood pressure, heart rate, waist circumference, and concomitant therapies were assessed. Weight measurements were recorded and fasting peripheral blood was collected. Fasting peripheral blood was collected to determine glucose and lipid profile. Serum chemistry and hematology were repeated at week 4 and week 8, and first morning void urine samples from 2 consecutive days were pooled for urinalysis at baseline, week 4 and week 8. A treatment diary was dispensed at baseline and week 4 and included forms to record daily product use, changes in concomitant therapies and adverse events and was returned and reviewed at week 4 and week 8. Adverse events were reviewed at week 4 and week 8. Analysis of oxidative stress markers. Laboratory tests for routine health markers such as complete blood counts, creatinine, aspartate aminotransferase, alanine transaminase, gamma glutamyl transferase, bilirubin, total cholesterol, HDL cholesterol, LDL cholesterol, triglycerides, and fasting glucose were conducted using standardized procedures at Life Labs Medical Laboratory Services in London. ON. Concentration of 8-hydroxy 2-deoxyguanosine was analyzed by enzyme immunoassay, Cayman Chemical, Ann Arbor, MI, CAT, 8-isoprostane by EIA, Cayman Chemical, CAT, superoxide dismutase by enzyme colorimetric assay, and thiobarbituric acid reactive substances was analyzed spectrophotometrically using Tibar's assay. Statistical analysis. As this was a pilot study, no formal sample size calculation was performed. Repeated measures, analysis of variance was used to compare pre- and post-treatment measurements of effectiveness and general health markers. Probability values less than 0.005 were considered to be statistically significant. The change from baseline to week 4 and week 8 were compared using Tukey's multiple comparisons test for 8-OHDG, 8-isoprostane, Tibar's, and SOT, total cholesterol, HDL cholesterol, LDL cholesterol, triglycerides, and fasting glucose. Adverse events were summarized descriptively using frequencies and categorizing by intensity and body system. A post-hoc sub-analysis was also conducted on female and male subjects to determine differences in response according to gender, and on subjects who were current smokers for effectiveness. As SAS version 9.1 was used to perform the statistical analysis. Results. Subject characteristics. All subjects completed treatment with mean compliance of 98.5 plus minus 3.3 and were included in the analysis. The baseline demographics of subjects are presented in Table 1. Subjects enrolled in the study included those who were hypertensive, pre-diabetic, and had total cholesterol, BMI, and or smokers. All subjects showed mean normal clinical levels of baseline biometric parameters, clinical chemistry, and hematology. The proportion of male smokers was greater than that of female smokers. However, all subjects were occasional smokers. The compliance with respect to reporting the number of cigarettes smoked in all visits was 100%. In 2 subjects, the number of cigarettes smoked remained the same throughout the visits, 10 and 20. Oxidative stress biomarkers. Oxidative stress biomarkers. Oxidative stress is a well-recognized mechanism playing an important role in pathological conditions seen in metabolic syndrome. The effect of hydrogen-rich water on markers of oxidative stress is presented in Table 2. The bars are a marker of lipid peroxidation, which is indicative of malondialdehyde formation and lipid damage, and is a well-established method for screening and monitoring lipid peroxidation. The concentration of urinary bars decreased significantly from baseline to week 4 and week 8. Subjects demonstrated a significant increase in SOD from baseline to week 8. Subjects demonstrated increasing trends in 8-isoprostane from baseline to week 4 and week 8. Then a post hoc sub-analysis by gender was conducted. Male subjects demonstrated a significant decrease in urinary bars from baseline to week 8 and a significant increase in SOD from baseline to week 8. During oxidative damage to DNA, damaged products are usually eliminated by repair enzymes and detected as nucleoside derivatives. Urinary 8-OHDG is one adduct of this reaction and has been proposed as a sensitive biomarker of oxidative DNA damage and repair. In subjects who were current smokers, there was a trend toward a decrease in urinary 8-OHDH and the bars levels from baseline to week 4 and week 8. Subjects demonstrated increasing trends in SOD from baseline to week 8 and 8-isoprostane from baseline to week 4 and week 8. Urinary 8-OHDH, 8-isoprostane, the bars and SOD were higher in subjects who were current smokers. Lipid profile and fasting glucose. Subjects demonstrated a significant increase in HDL cholesterol from baseline to week 4 and week 8, and a decrease in total cholesterol HDL ratio from baseline to week 4. Post hoc sub-analysis by gender demonstrated that female subjects had a significant increase in HDL cholesterol from baseline to week 4 and a significant decrease in LDL cholesterol and total cholesterol HDL cholesterol ratio from baseline to week 4. There were no changes in HDL cholesterol HDL ratio and triglyceride from baseline to week 8. Male subjects demonstrated significant increase in HDL cholesterol from baseline to week 4 and week 8, and significant decrease in total cholesterol HDL ratio from baseline to week 4. The effects of hydrogen-rich water on the lipid profile in subjects who were current smokers demonstrated that there was a significant decrease in total cholesterol HDL ratio from baseline to week 4, data not shown, and a significant increase in HDL from baseline to week 4. Results showed that there were no statistical differences from baseline to week 8 for fasting glucose in participants. After consumption of hydrogen-rich water, data not shown. Biometric parameters, clinical chemistry and hematology. There were no significant differences in blood pressure, heart rate, weight, BMI assessed at any time point. Data not shown. Analysis of clinical chemistry parameters demonstrated that ALT and creatinine were significantly decreased from baseline to week 4 and week 8 in all subjects. Further analysis demonstrated that 80% of subjects, 9 females and 7 males, had a decrease in ALT from baseline to week 8, and 95% of subjects, 10 females and 9 males, had a decrease in creatinine from baseline to week 8. The decrease in ALT was significant from baseline to week 4 and week 8 in female subjects, but not male subjects. Creatinine creatinine was significantly decreased in both the genders from baseline to week 4 and week 8. Significant increases were demonstrated from baseline to week 4 and week 8 for bilirubin in subjects on hydrogen-rich waters. 8 females and 7 males demonstrated an increase in bilirubin from baseline to week 8. This increase was significant in female subjects, but not in male subjects. GGT was significantly increased from baseline to week 8, with 85% of all subjects demonstrating an increase during this period. 8 females and 9 males. 90% of all subjects demonstrated a decrease in AST from baseline to week 8, 9 females and 9 males. This decrease was significant from baseline to week 4 and week 8 in female subjects, but not in male subjects. The mean values for these parameters were within the normal acceptable reference range for male and female subjects. In subjects who were cured smokers, significant increases were demonstrated from baseline to week 4, week 8 for bilirubin, and this increase was within normal acceptable references range. That data not shown. Adverse events. A total of 28 adverse events were experienced by 13 of the 20 subjects, which is 65% enrolled in this study. Overall, 6 adverse events experienced by 4 subjects, which is 20%, were assessed by the investigator as having a possible relationship to the test article. These adverse events included loose stools, increase in frequency of bowel movements, heartburn, headache. These adverse events having possible relationship to the test article were classified as mild in intensity. There were no serious adverse events which occurred during this study. Discussion. In this study, we demonstrated that drinking hydrogen-rich water increased urinary antioxidant enzyme, SOD, an endogenous defensive system against ROS-induced cellular injury. An endogenous defensive system against ROS-induced cellular injury associated with reduction of oxidative stress markers in subjects with metabolic syndrome. SOD plays an important role in the antioxidant defense system against superoxide and generated in vivo and is involved in defense against many diseases. Our data demonstrated that subjects consuming hydrogen-rich water for 8 weeks showed significantly increased SOD levels from baseline to week 8, suggested that hydrogen-rich water is capable of inducing SOD activity. Although the detailed mechanisms are undefined, an increase in SOD levels correlated with the decreasing trends in 8-OHDJ levels and thus supported our hypothesis that oxidative stress is reduced by consuming hydrogen-rich water. Oxidative modification of LDL in the arterial wall plays a key role in the pathogenesis of atherosclerosis. A high level of HDL cholesterol is reported to protect against cardiovascular disease, and low HDL cholesterol levels less than 40 mg per deciliter increase the risk of heart disease. Results of the current study demonstrated a significant increase in HDL cholesterol, leading to a significant decrease in total cholesterol HDL ratio by week 4. Decreasing trends were also seen for LDL cholesterol from baseline to week 4. The triglycerides from baseline to week 8. Though there was an increase in total cholesterol and LDL cholesterol in subjects consuming hydrogen-rich water from baseline until week 8. These values were not clinically significant and were still within a normal acceptable range. The increasing trends may possibly be associated with higher saturated fat consumption, individual food habits, and physical activity of subjects. It's possible that the hypolipidemic effect of hydrogen-rich water may be due to its ability to prevent lipid peroxidation. Its ability to prevent lipid peroxidation as demonstrated by the significant decrease in the bars, resulting in lower total cholesterol HDL ratio, triglycerides, and an increase in HDL cholesterol. Although an improvement of lipid and glucose metabolism after supplementation with hydrogen-rich water have been observed in patients with type 2 diabetes, our results showed that there were no statistical differences in fasting glucose in pre-diabetic participants from baseline to week 8. These results are supported by a previous study where hydrogen water was found to lower the blood glucose level of participants with abnormally high blood glucose levels and did not induce a reduction of a normal blood glucose level. GGT is an enzyme widely distributed in the human body, especially in the kidney and liver. The results of the present study demonstrated that there were a significant increase in GGT within group from baseline to week 8. However, this increase will still within the normal acceptable clinical range for these values for both female and males. Previous studies have shown that there is a positive association between dietary factors and GGT levels. Alcohol and meat consumption are reported to increase GGT levels in a dose-dependent manner. However, as food records were not maintained in this study, we were unable to confirm that increases in the GGT levels were related to these factors. As the other liver markers, such as AST and ALT, were not impacted, it's possible to suggest that hydrogen water did not have a negative effect on liver function. In this study, we found that AST decreased from baseline to week 4 and week 8 in both male and male subjects, and these decreases attained significance in female subjects. The levels of ALT decreased significantly from week to week 8, and in the subgroup analysis, this significance was also seen in the female subjects. Taken together, it's possible to suggest that the increases in GGT may reflect changes associated with food intake and alcohol consumption of the participants. The values for GGT remained within acceptable clinical range for this parameter. Interestingly, subjects demonstrated a significant increase in total bilirubin from baseline to week 4 and week 8. These increases remained within normal clinically acceptable range. Serum, ALT, and AST decreased with hydrogen-rich water consumption, and the elevation of bilirubin levels seen in this study may be a specific effect afforded by the hydrogen. Schwartner et al. Previously reported that there was a significant inverse correlation between bilirubin concentration and the prevalence of cardiovascular disease, and lower serum bilirubin concentrations were correlated with the presence of ischemic heart disease. Madewan et al. Showed that plasma bilirubin concentration is positively correlated with HDL cholesterol and confirms the results demonstrated in our study. Thus, the elevations of serum bilirubin levels below toxic levels are likely to be protective for cardiovascular disease. The exact mechanisms involved in bilirubin elevation in the subjects treated with hydrogen-rich water are not fully understood. However, the antioxidant effects of hydrogen may not be the sole explanation for this increase, and other, as yet undefined mechanisms may not involve, such as a role in signaling pathway or perhaps other psychological functions. There is a possibility that the higher bilirubin levels are associated with the degradation of heme by heme oxygenase into accumular quantities of biliverdin, bilirubin, and carbon monoxide, while the central iron is released. The induction of heme oxygenase, which is the rate-limiting enzyme, catalyzes the degradation of heme. Further studies are required to determine if hydrogen can induce HO1, as our hematological data was not altered by hydrogen water consumption, and as the elevations in serum bilirubin remained within the normal acceptable range. It's not likely that hemolysis contributed to the increase of serum bilirubin levels. Mean values of all hematologic parameters were within normal clinically acceptable range. Biometric parameters assessed as a measure of safety remained unchanged during the 8-week period of the study. Results also show that there were no changes in blood pressure, BMI, and weight in subjects after consuming hydrogen-rich water for 8 weeks. A sub-analysis was conducted on subjects who were smokers, as previous documentation has established that smokers are likely to have more oxidative stress and thus may show a greater benefit from an antioxidant intervention.
Diligence.
Çalışkanlık. Diligence, willingness. Statistical guidance and analysis was provided by Larry Stitt, Assistant Director of Biostatistical Support Unit, University of Western Ontario, London, Ontario, Canada. We acknowledge the technical contribution of Joshua Beasley and thank Sonia Bars for overseeing the conduct of the study. This study was supported by Frontier Inc., D. Kopuch, Minami, Ioma, for F. 5-10-13, Minami, Ioma, Minato-ku, Tokyo, Japan. Abbreviations: 8-isoprostane, 15-F2T, 15-isoprostane, 8-isoprostane, F2T. 8-OHDH 8 hydroxy 2 deoxygonoxin. ALT alanine transaminase. ANOVA analysis of variance. AST aspartate aminotransferase. BMI body mass index. DNA deoxyribonucleic acids. GCP good clinical practices. GGT gamma glutamyl transferase. HDL high density lipoproteins. LDL low density lipoprotein. IRB institutional review boards. MCH mean corpuscular hemoglobin. Mg magnesium metal. MgOH2 magnesium hydroxide. ROS reactive oxygen species. ST standard deviation. SOD superoxide dismutase. TBARS thiobarbituric acid reactive substances. EGFR estimated glomerular filtration rate. HO1 heme oxygenase references.